All right, let's talk about something a ton of people deal with: eczema. Or, its official name, atopic dermatitis. This is so common, especially for kids, and it's way more than just a patch of dry skin, right? It's this chronic, inflammatory condition, and it has this perfect nickname, the itch that rashes.
So, the itch that rashes, why that specific phrase? Well, it's because the order of events is absolutely key here. For most skin issues, you get a rash and then it itches. But with eczema, nope. The itch comes first. That crazy, intense itch, what doctors call pruritus, and the rash you actually see, that's what happens after you scratch. It's a total reversal.
And yeah, this is what it can look like in real life. You see, atopic dermatitis isn't a one and done thing. It's chronic. That means it comes and goes in this really frustrating cycle. You have these flare-ups where things are bad, and then periods of remission where your skin feels okay again. It's this constant up and down that can just be exhausting. And get this, we're not talking about some rare condition. We're talking about 15 to 30% of kids worldwide. That is a massive number. And it doesn't just disappear. Up to 10% of adults deal with it too. So the takeaway here, if this is your reality or you know someone who has it, you are definitely not alone.
Okay, so let's dig into that experience. Let's really break down what's going on in that vicious cycle. The thing about eczema is that it's not just skin deep. Not at all. The main symptoms, that relentless itch and the rashes or lesions, they can completely take over your life. We're talking about ruining your sleep, making it impossible to focus at work or in school. It just chips away at your quality of life. It's a huge deal. And this, right here, this is the trap. This is the itch-scratch cycle. It all starts because the skin's protective barrier is weak. So step 1, irritants and allergens sneak in. Step 2, they trigger that itch. Step 3, you scratch. And oh, it feels so good for a second, right? But that scratching just damages the barrier even more. And that leads to step 4. The skin freaks out, releases more inflammatory stuff, and guess what? The itch gets even worse. It just feeds itself over and over. So that's the cycle. But what starts it? What's the root cause? Well, it's kind of like a detective story with two main culprits working together.
Okay, so here are our two culprits. On one hand, you've got a faulty skin barrier. That's a structural problem. And on the other hand, you've got an overactive immune system. That's a response problem. Basically, your immune system gets the wrong memo. It sees totally harmless stuff like pollen or dust as a major threat and launches this huge inflammatory counterattack. And that attack is what causes all the redness, the swelling, and that unbearable itch. Let's use an analogy here. Think of your skin barrier like a strong brick wall. The skin cells, those are the bricks, and the mortar holding them all together, that's a mix of fats or lipids and proteins. When this wall is solid, it does two jobs perfectly. It keeps the good stuff, like moisture, in, and it keeps the bad stuff, like germs and allergens, out. It's your body's fortress. But here's the problem with eczema. That mortar is crumbly. The brick wall is leaky. And when that happens, you get a double whammy. First, all that precious moisture escapes, which is why the skin is always so dry. And second, the gates are wide open for all those irritants and allergens to waltz right in. And when they do, they trip the alarm, and that overactive immune system goes into overdrive. Okay, so the wall is leaky. The next question is pretty obvious, right? Why is it leaky in the first place? And the answer, it turns out, is a mix of nature and nurture, our genetics and our environment. On the genetic side, one of the biggest players is a gene called Filaggrin, or FLG for short. Think of this gene as the recipe for making a really important protein in that skin mortar. If you have a mutation, a typo in that recipe, your body can't make the mortar properly. This means you're basically born with a weaker, leakier skin barrier. And yeah, this is a huge risk factor, especially for severe eczema that starts really early in life. But look, genes aren't the whole story, not by a long shot. This is where your environment comes in. We're talking about things like cold, dry air, harsh soaps, stress, even the clothes you wear. Now, these things don't cause eczema, but they are absolutely triggers. They're the things that poke holes in that already weak barrier and get that whole itch-scratch cycle fired up. Something that's super interesting about eczema is how it presents itself. It's not a one-size-fits-all condition. In fact, where you see it on the body can change dramatically as you get older.
And this pattern is actually a huge clue for doctors trying to diagnose it. So for little babies, you'll often see it on their chubby cheeks and the outside of their arms and legs. Then, as they grow into kids, it tends to move into the creases, inside the elbows, behind the knees. And for adults, it can still be in those creases, but it very often shows up on the hands and the neck. Now, this is a really important idea. For a lot of people, eczema is just the first step in what's called the atopic march. It's this typical pattern where a kid with eczema might later develop food allergies, then hay fever, and then maybe even asthma. The theory here is pretty compelling. Because the skin barrier is leaky, allergens get into the body through the skin, which primes the whole immune system to be on high alert. It's like the skin is the gateway for developing other allergies down the road. Okay. So we've got the what, the why, and the how it changes. Now for the most important part. What do we do about it? How do we fight back and manage this thing? How do we rebuild that fortress? First things first, let's be really clear about the goal. Right now, there is no cure for eczema. So the name of the game is management. It's all about long-term control. That means calming down those flare-ups, keeping symptoms in check, and, this is the big one, working to strengthen that skin barrier every single day, even when your skin feels fine.
The treatment approach is kind of like building a pyramid. The foundation, the absolute base that everything else sits on, is barrier repair. We're talking daily moisturizing with things called emollients. That's non-negotiable. Then, when you have a flare-up, you climb to the next level, inflammation control. That's where medicated creams like topical steroids come in to calm down that angry immune response. And then, way at the top of the pyramid, for really tough cases, you have things like light therapy or even systemic medications.
So what does that daily defense look like? Well, it's all about being proactive. Use gentle, fragrance-free soaps. Slather on that moisturizer every single day, especially right after a bath or shower. Figure out what your personal triggers are and try to avoid them. Stick to soft, breathable fabrics like cotton. Oh, and keep those fingernails short. It really helps prevent damage when you do get that urge to scratch. Okay, here's a super practical pro tip for you. When you do have to use a medicated cream, one of the biggest mistakes people make is not using enough. There's a really simple tool to fix this called the fingertip unit, or FTU. It's exactly what it sounds like. You squeeze a line of cream from the very tip of your index finger down to the first knuckle crease. That's 1 fingertip unit. So, how much does that cover? Well, that one little line of cream is the perfect amount to treat an area of skin that's about the size of 2 of your hands, palms flat. It's a foolproof way to make sure you're using enough to actually work, but not too much.
So, when you boil it all down, what's the most important takeaway? It's this. Managing eczema is a marathon, not a sprint. It's all about that consistent, day in, day out, proactive care. That's what really keeps that skin fortress strong. And this all leads us to one final big question for the future. We know it's a two-headed monster, right? A leaky barrier and a hyped-up immune system. So the next true revolution in treatment won't just be about quieting the itch. It'll have to be about something that can fix the wall and calm the guards at the same time. And figuring that out, well, that could be the ultimate game changer.